host, Dr. Charley Ferrer. Here's another episode of Cancer Tamer. Today, our special guests are Dr. Azher Saddiqi, and of course, you might remember Carol DeMarco, who was here with us before talking about Reiki. So what I want to talk about today is something that's on everybody's mind, and we're going to talk about medical marijuana. So thank you, Dr. Azher, for being here with us. If you can tell us a little bit about medical marijuana and what it is, what it isn't.
Yes, marijuana has been around cannabis for a long time, and these past few years, the medical aspect of it, the medical indications, the research has started. Okay, a lot of it is done overseas. Research started now in the country. Also, a lot of research has been going on, and as of this January, New York State legalized it for medicinal use.
So January 2016.
Yes.
Okay, and so what's the difference between medical marijuana and just going out and getting pot?
Well,
or Mary Jane's or whatever it is that we want to call it.
Right, yeah. Well, the medical marijuana is the more, it's cultivated by, approved manufacturers, which New York State has approved. And the exact formulation, the ratios between the THC and the CBD are well designed, okay, all right? Different formulations have been approved. Now, as opposed to if you go out and buy it on the street, the pot, mostly it's inhaled, okay? Now, along with the inhalation, a lot of other impurities are going in, carcinogens are going in. So it's like smoking, like smoke with the added carcinogens.
So the carcinogens are those additives or those pesticides that they put into like cigarettes and such?
Right, cigarettes and stuff.
And
so those are going in, and really the
but that's on the street marijuana.
Right, that's the street marijuana.
As opposed to medical marijuana, which is healthier, I guess, for you?
Right, the medical marijuana is, again, the different forms are available, okay, which based on the patient condition and the preferences, okay. The state has approved basically the oral version, which is in the form of capsules. There's a sublingual version, a liquid oil version, which gets absorbed under the tongue. And the more recent addition has been, the past couple of months, has been the vaporized, like a canister. It's called a VAP, which is almost like an asthma.
So you just
canister,
like a nebulizer.
Right. It's like an asthma pump, but a more refined, vaporized, but without the without the impurities and other factors that will come in, if you're smoking like a regular pot.
So are you saying that there are no carcinogens in your marijuana?
Right, yes. The ones which are manufactured, through these approved facilities.
Not his marijuana.
Well, I like when you make it in the little
but
room.
he's going in the room and pulling it off the pot.
Who's
the
actually,
medical use of the marijuana.
Who's actually making it then?
Well, I think there are like 3 or 4 manufacturers which the state has approved, Bloomfield Industries and a few others, okay, all right, and under controlled environment, they're being manufactured. There was, last year the legislature had opened it up for bidding and whatnot, okay, and then they approved a certain number of manufacturers. So they're the ones who've been approved, and they're the ones who will be delivering to the different versions and to the pharmacies. Also designated, only certain designated pharmacies in the 5 boroughs have been approved.
So they can actually get it from something like Walmart or CVS
no.
or something,
It's
or is
actually,
it a specific
it's actually a
pharmacy?
dispensary.
Right.
Okay.
We're referring it to as a pharmacy so people understand, but there are dispensaries.
Okay, so
that
you
are-
can't just go up to like Walmart and say, "Hey, where's my pot?
No.
bag? I want a nickel bag."
Guy on the corner, you could do that, but not Walmart.
It's not Amsterdam or Denver yet.
Okay.
Now, is the FDA, do they approve it, or it doesn't have to be approved by them?
Yeah, the federal government technically has not approved it. It's still not legal under the federal law, okay? But they've given it to the states. But they've sort of held like a hands-off approach. Let the states decide their own thing, how to legislate it, how to. But under federal law, it's not legal. All right.
Okay. So if you are, and I have questions about the marijuana itself, but if you are authorized to do it, I guess there's a whole big long process for you to get approved as a patient to be able to get this. So you get a little card that says you're approved for medical marijuana in case the cops stop you and
Right, correct.
so you don't
there's
go to jail.
Right, there's a process involved. Okay, I mean, it's the New York State Department of Health has made there's a process. All right,
Okay.
it starts off with the patient visiting us. Okay, we do a comprehensive history, physical. Okay, right, and then based on the diagnosis, the state has approved certain diagnoses for which it can be recommended, and so we go through that. Then there's an online site. Department of Health has we have to go online to their site, and we register there as a registered medical marijuana provider.
Okay.
And then the history is filled there. The form is completed. Okay, it's important that the patient has a New York State photo ID.
Okay. And so I'm going to cut you off because if you want to know all the ways to get your card, then feel free to go to our website, cancertamer.org, and we'll have more information so that you can connect with Dr.
Saddiqi.
Sorry, I was going to say your
Azher.
first name. So Dr. Azher Saddiqi. But what I want to talk about more than that, actually, is there's two different types of the marijuana, and one of them was the THC and the CBD. And can you tell us the difference between each one? What is the THC?
Well, the THC is the tetrahydrocannabinol. That's the full pharmacological name of it. Okay, right? And it's a product in the plant, the cannabis plant. Okay, which sort of mimics the body has an endocannabinoid system, which is being looked into in these past 3 decades of, and the plant one sort of mimics that, okay, and attaches to the same receptors. So the THC is the more active version, okay, which can goes into the quick absorption, goes into the nervous system, okay, right, is the more potent, okay.
And that's the one that deals with appetite.
Right, appetite
and
pain,
and it helps
nausea, right,
reduce.
reduce
Okay,
that.
so that's
right.
why they give it a lot to cancer patients,
Right.
especially those that are going through chemo.
Chemo, yes.
Do they also give it to patients that are going through radiation or not?
It can,
just
right, yeah.
chemo?
I mean, no, it can be given to folks on radiation. In a cancer in general is one of the approved indications for giving medical marijuana, and the exact mechanism of actions are not known, but it's primarily the THC part which is working on these receptors, okay, and for the anti-nausea effect, okay, right, for appetite stimulation, all right.
Okay. And you mentioned that it's an oil or a vapor, or are you
Yes,
sitting there smoking it, or?
Well, there are different versions of it.
It's
now,
a few
right,
different
we sort of
versions.
decide on someone who's like really naive, okay? I mean, it has had no exposure whatsoever, okay, all right, recreational or otherwise, totally naive to this product, okay. So I generally do the initial recommended either as like the sublingual or the gel or
And
the gel
sublingual
capsule.
is
Sublingual meaning it's
It dissolves under the
goes
tongue.
under the tongue. It will
Okay.
come with a little bottle with a dropper, and then it's given under the tongue, gets absorbed that way, okay, all right.
Okay.
And there's the capsule, which has also been available. It's a little more slower acting, the capsule, the gel caps. Those would be probably the two which the totally naive patients. Folks who have had prior exposure, like in recreational, a lot of patients have been, have used it
Yeah.
recreationally, when it was
Not that
students
I've
or-
ever done
right,
that.
Right, during the college years, student life, it's been,
It's
been
out
popular.
there.
It's out there. It's been
Right.
popular
Or
over
you're
the
walking
years.
through your hall.
Right.
Because
Smell
I
it.
know I can smell it in my hallway sometimes.
Yes.
Right.
And I'm walking through going,
Yeah.
if you're gonna smoke it, smoke the good stuff.
Yeah.
Because sometimes it's the
Yeah.
really smelly one, so
Right.
you know that's not the medical one.
Right.
So the THC, though, is that a natural form or synthetic form when it's made for the
The
patient?
THC, when it's made, it's synthesized, it's derived from the plant, but they've
Ah.
improvised it. Okay, they made it more pure,
So
then
it's
they
more
did
potent.
right, more potent. Then they they do the ratio with the CBD, which sort of is more for like inflammation and for pain. Okay, but it's not. It doesn't penetrate. The CBD part doesn't give you that
High
high.
feeling.
That high feeling doesn't penetrate the brain. It sort of has like a speed bump on the on the THC.
Right, which is one of the questions that I was going to ask you about the CBD part of it, which is another form. And that one is stated not to affect the mind, not to affect your behavior, so you don't get that,
Right, don't
I'm
get the
high feeling.
Right, that high feeling or a psychosis, like a psychotic delirium, okay,
Or
which can
paranoia.
have, right, paranoia, that, and then more.
But it does make you eat more.
Well, does it make you eat more?
So there, so that's the cannabinoid, all right, which is and the products which the dispensaries or these pharmacies will dispense will have the different the high THC to the low CBD, then there's the equal ratios 1:1, and then there's the low THC and the high CBD, okay, right? So so we'll do the initial recommendation, and then subsequently, the pharmacies will fine tune the product.
Fine-tune it.
Right, yeah.
Do you take into effect or factor how much the person weighs before you prescribe it?
Yes, that can take into account. I just sort of there's no exact roadmap. A lot of this is new. Sort of everybody's like on a little bit of like a learning curve.
Yeah.
Okay, we are
So
on,
it's,
right.
so it's not
sort of
like
a-
alcohol. If somebody Deborah's size were to consume 4 glasses of wine,
I can't even handle 2.
she'll be
Right,
walking and staggering.
right,
But if someone
right.
who's about 250
Right, 200, yeah,
pounds,
huge,
they
right.
can
They
they
can
just
take,
think that's
more
a
of
walk
that.
in the park.
Right, yeah.
So,
So if
okay.
somebody's really thin, cachectic, we'll go with like a smaller amount, okay, right? Someone who's been like a heavy recreational user, okay, all right, and has
So they have more.
then
Tolerance?
more tolerance there, and then we go straight to the vaporized version, okay, and adjust it that way, okay.
And so, one other question before I want to ask Carol some questions too. Now it comes in a vapor form. It comes in a tablet or a capsule form,
yeah,
and then the drops.
Right.
I kind of like that idea. So, what about putting? Is there an oil one too, where you can put it on the skin, or because it'll be absorbed
Right.
by the
I know,
body as
right.
well?
Yeah, there are. Yeah, but officially by the I'm not sure, maybe Carol can help. But I think officially the 3 versions are by the state. Okay,
Right.
the oil topical version. Okay, a lot of it are being used. Okay, the aroma the aromatherapy in conjunction with that. Okay, which Carol might be able to give a little more information on that. But the state-wise and I think at the dispensary-wise, those 3 versions are available. Okay.
Okay.
Yeah.
May I ask just about the cost, because I don't know if it's covered by insurance.
Yes, the insurance doesn't cover it. Neither,
Heavy drugs.
because, like I said, the feds don't recognize it. Okay, but at some point, when the tide is changed, they'll at some point down the road they may. Okay, but it's not insurance covered. Okay, so because the cultivation, the production, the all that is not. You really can't do much through regular banking. Okay, this business. Okay, right. So it's
So is it the same as the street version? I mean, is it like? I'm
No,
sure
no,
it's
right,
not like
yeah, no, it's
$5.
not, right,
I don't
right,
know.
no.
You know, your nickel bag or your.
No,
or your,
no.
You can tell I'm really old.
Right, right. No,
but
that,
you know,
right. I mean, the
so
quality.
it's-
The state has put quality control on these dispensaries and on these matters. That's one of the reasons that was they've gone through this approval process is to this quality control. Okay, except at the Fed level, it needs I guess more needs to be. The
So
thought
what
process,
are-
the thinking.
So what
has
are
to
they
change.
looking at as far as price? I guess is what we were getting
Because
at.
I've been hearing
Is it-
maybe $100 a month, depending on how much you
Well,
need.
depending on what they
Yeah.
need for the month.
Right,
It's,
yeah.
But let's say in the bottle to put under the tongue. How much is a bottle, let's say?
I think
It's
50,
anywhere from
55,
50
right, 50
to
$60,
70
yeah,
or
right,
something like
like
that.
That'll
in
last
that
you for a
range.
month.
And now that's
No.
going to last you probably for the week. It is actually, from speaking around and asking people, the street value is equivalent to what you're getting at the dispensary.
Yeah, and I'm
So-
going to interrupt us one time, but for our camera people or for those that are listening to our show, we have a weird kind of echo. And so if you hear it, just technical difficulties, like everybody else. But we hope our people will get to that. So.
Yeah, so that's, it is going according to the street value, basically, of what, the prices and stuff that also the dispensaries are costing. So most people will get it for the month because it's easy to pick up. They don't have to go each week, so it's, most of the time they do get it for the full month.
Okay, and what side effects are we looking at here? I mean, there's always side effects to anything you use.
Now, the main thing we also check with the patient prior to initiating is that if there's any history of like psychosis, schizophrenia, right, then the guidelines are really not to prescribe it or not to recommend it, rather. Okay, right? It can theoretically provoke a psychotic episode if there is an underlying history of psychosis or schizophrenia, or bring on an exacerbation of schizophrenia, okay, requiring
or if
serious
anyone has paranoid delusions or anything like
right,
that.
yeah. So because that can provoke that. So if there's no history of that, then the other thing is if there's a severe, like a cardiac history, okay, then we like to be cautious. Not a complete contraindication, okay.
A cardiac condition,
right,
you mean?
right,
Okay.
right. Bad heart failure, congestive heart failure, bad cardiomyopathy, okay. Just to be cautious on that, okay. But and then also not to mix it with alcohol or
any
take on
drugs,
to right. Other obviously that's not.
Don't go out and drink your
Right.
or take your
Right, yeah.
OxyContin and then
Right.
Can you
and
imagine
then
that?
try. You'll have a
Right,
really
right,
interesting
right,
high.
yeah. So, but for its analgesic effect, it can help reduce the amount of painkillers patients are using. Okay, if they're on a high dose of OxyContin or high dose of oxycodone or any the opioid painkillers, because one of the indications for medical marijuana is a painful neuropathy, which is neuropathic pain from could be from diabetes or connected lupus or any.
And I was thinking of the aromatase inhibitors that we
Uh-huh.
take and how you end up getting a neuropathy from that.
Right, from
from
chemo
either or.
products or from the cancer itself. There's a neuropathy is a painful paraneoplastic syndrome, which is one of the So it's one of the indications for it. And then someone who's on a high dose of painkillers, it can help, if not completely, cut the dose down.
And there's no addiction to it, is there?
On the the marijuana is not like there's no pure addiction to it. Okay, really, if you look at the literature which I've studied, there's no isolated cases of typical like a marijuana overdose. You never see it in the hospital. I go to the hospital, and we see tons of overdoses on opioids all the time. Alcohol intoxication, tons of it. Okay, but an isolated pure marijuana overdose, we haven't seen. Okay, right. It's not even described. Even the literature doesn't really support much isolated. Of course, mixed with heroin, mixed with other things, that's another ball game. Okay, right? Yeah. I mean,
yeah. Well, that's another stupidity.
Right.
It's
Exactly.
more
Yeah.
like
People are
So you started out board certified internal medicine, and then you decided to branch out to
Right.
weight loss, nutrition.
Yes. Primarily trained in primary care internal medicine, and then over the course of the passage of time, a lot of interest with weight, overweight, because it's a big problem in the country, and other alternative medicine. Okay, previously I was in traditional medicine. It's not generally taught. The alternative medicine. And it's held with somewhat skepticism and with contempt, to tell you honestly. Okay,
and you're right.
Right.
You're right.
The
because
traditional
people
medicine,
don't-
right, in med school, it's not. The curriculum is not geared towards that. Okay, right. So when students coming out of med schools or residency, they're not really in tune with that. Okay, all right. The cannabis, medical marijuana, is still in the traditional medicine is controversial. Okay, although more and more is coming out now with the state legalizing it, and most states in the country. I think in this election also, I think there were 4 or 5
more.
new states who were
States.
legalized it out in the West, and so.
Yeah. I
more-
know Washington is already legalized.
Washington D.C.
Washington
Yeah.
State.
Oh,
Sorry,
state, right,
Washington
yeah.
State.
Yes.
Right.
Is already legalized. And so one of the things before we go on to a couple of other things that I'm very interested in what you do, I wanted to bring in Carol for a moment, because we had mentioned briefly about the fact that you also work with Reiki and doing massage and so on. And so, and you brought up a wonderful point, Dr. Saddiqi, that most of the people see this as hokey or as alternative, or it's not science-based, so it's not really in there. But as we saw last time when Carol was on with us, she did a little session with me on Reiki, and she actually discovered that I have, problems with my thyroid. Which, for those of you skeptics out there, I never told her anything about it.
I was shocked.
Yes, and I was shocked too, because she's going, oh, well, you have something going on with your throat. And I was like, yes, I was diagnosed with issues there. And so what I wanted to talk about, though, was, do you use the oil-based marijuana in your practice in Reiki or with massage or anything like that?
I have, before it even actually was passed by law. If a patient came in and they had the cannabis oil, I told them to bring it, and I would put it on them and use it. And that's why Dr. Saddiqi and I would always talk about it. And I know he's open to a lot of the holistic work that Anthony and I do there. So it just happened to work. So it's a good balance between what he does and what we do. It just seems to work together. And a lot of times, like, if we feel we can't get any further with the holistic approach, then we always ask Doc if what else we can do with that and help them. So,
yeah. Which I guess the important piece is about, bringing traditional or Western medicine into the combination of Eastern medicine and just
Right.
alternative medicine and holistic medicine, and being able to combine it all.
Right.
Because I know there's a lot of people out there that don't subscribe to all the medications that are being handed out for cancer, or because they can't tolerate it, and they'd rather not, contaminate their body or toxify their body with some of the medicine that's going out there. It's wonderful to be able
Right.
to do other things, to have other alternatives like the medical marijuana or like Reiki or other possibilities.
Well, that's what we're finding. I mean, I take the phone calls for Doc, and we set up the appointments, and most of the people that are calling are like, I just can't stay on this medicine anymore. Can you help me? I'm hoping that the cannabis would help, and they're really in dire need of pain, and they're having so many issues. And a lot of them, since we started the program in March, right? We started in March.
Mm-hmm.
They're coming back and saying, you gave me quality of life back. I mean, so that's a great thing to hear. So
That's
it is
fantastic.
helping. Yeah, it really is.
So do you put the oil, when they bring in the oil, because they have to bring it in, do you put it in on any specific part of their body, only what hurts?
Well,
How does
usually
that
I'll do
work?
it on the back of their spine. That's where the aromatherapy oils would actually go. So I'll start it on the back of the spine, and then I always put it over the area wherever the problem is. So
Okay.
Okay, and they're saying that it's helpful for them.
yes, it gets into the cells in that way also. So a lot of times being it
Yeah.
massaged into them, also helps.
So it basically relieves pain. Is that what the cannabis is all about? Relieving pain and maybe staying calmer?
Right, pain, inflammation, okay, right? And then some mechanism of action is not clear, okay? For example, it's been approved recurrent seizures, okay, especially in kids, okay? I mean, some of the earlier research, especially in Israel, has done a lot of research in this. It's government funded. It's all, so a lot of it has come from there. So, and so the exact mechanism is someone is not known. Spinal cord injuries, okay, right? It's being approved for use, okay. So like an anti-inflammatory effect, an analgesic effect, combination. Specifically, how an anti-cancer effect, the jury's still out. Okay, how the at the molecular level how that works. Okay, right. But it's through a lot of indirect ways. So I mean, we've had patients who've been referred by oncologists from Sloan, Sloan Kettering. I mean, they don't do it. Okay, but they said patients
It's
if
like
you
you don't know what the
Right.
left hand is doing,
Right.
and so
But you
as
have
long
to
as
be
you get
open-minded.
as long
Right.
as you get open-minded, and
Right.
we're almost out of time, so I want to make sure that if there's anything that we need to let our viewers know, any important information that you want them to know.
Do they need any kind of medical clearance?
Right, yeah, the way it works is, like I said, it needs an initial certification from us. A consultation visit, we generate the certification with the diagnosis and the the first form of whether the oral, sublingual, or the vaporized version. It's on the recommendation on the certification. So then the patient is given that, and then they have to create an account with the Department of Health. We show them the process. They have to open an account, then they must have a New York State photo ID. It goes on, gets uploaded, or it's all in our instruction package. Okay.
And again, you can get that information at our website, cancertamer.org, and we'll refer you to them. Carol, was there anything that you wanted to say before we close?
No, that's it. I mean, and the process is pretty quick. It takes maybe about 5 business days for them to get their cards from the state, and then from that point we refer them to a dispensary so they can start the process of getting together.
I want to know about the benefit or any awesome words that you want to let our viewers know, because everybody knows red tape is red tape and it's going to be there.
Right.
But
well, it really is helping. I mean, and that's the whole reason why we went into this whole process of doing the cannabis. It is helping people out there. It's helping them with their pain. It's helping them to deal with, their nauseous and everything else from the chemos and everything else that they're getting out there. I just want everybody to know that there is other alternative help, and we do a lot of that. So.
And that's what Cancer Tamer is all about. So if you've been watching our shows for the past few months, since we're new and hopefully we'll be around for another 50, 60 years, you'll
The show and us.
Exactly.
Try some cannabis.
Yes, and we try to bring you here on Cancer Tamer all the different possibilities that are out there. Everybody knows about chemo, everybody knows about radiation, but not many people know about all the alternatives, like cannabis, like Reiki, like acupuncture, like hypnotherapy, massage therapy. I mean, there's so many possibilities out there that aren't the traditional, and I want to rephrase that, not the traditional, because it can be traditional in other countries. But here in the U.S., we tend to go more for modern medicine and, pharmaceutical cures for everything, when in fact there are so many other possibilities out there that other countries have been using for millennia, right. Thousands and thousands of years. So I think it's important for us to look at those aspects. And, of course, we're not telling you what to do. Always go to your doctor and find out what's going on, but also, do your own research, advocate for yourself. So I want to say goodbye now. I'm Dr. Charley Ferrer. Thanks for watching.
Thank you.
Thank you.
Thank you.